Patient assessment and management, trauma. I have my PPE on. Is the scene safe?
Safe.
Okay. So what is the mechanism of injury?
16-year-old male fell out of two-story window.
Okay, so I'm going to, how many patients are there?
1.
Okay, I'm gonna request additional EMS, and I'm gonna stabilize his C-spine because he did fall out of a building. So I'm going to measure his neck with my fingers. Then I'm gonna get my C collar. I'm gonna put it on him. Okay, what is my general impression of the patient?
Male in supine position, unconscious.
Okay, so the male is in supine position. He's unconscious, but I'm still gonna check for responsiveness. Sir? Okay, there's no response. The patient is unconscious. So the chief complaint, I can't really get that, but from what I see, the patient fell out of a building, so I'm just gonna be treating them, their entire body from head to toe. So I'm going to start with the airway. So I'm gonna assess the airway. I'm gonna open the patient's mouth, and I'm gonna check if the airway's clear. The airway's clear, and I'm gonna get an airway adjunct, and I'm gonna place it into the patient's mouth to keep it open. Then I'm gonna assess breathing. I'm gonna check the patient's breathing. Okay, I can see the patient's breathing with his chest rise and chest fall, and I see air coming out of I can feel air coming out of his mouth. Okay, so now I'm gonna put the patient on a non-rebreather mask at 10 liters per minute. Okay, the patient's now on a non-rebreather mask at 10 liters per minute. I'm gonna check for adequate ventilation, so I'm gonna look for chest rise and chest fall. Perfect. There's adequate ventilation with the non-rebreather. And then I'm gonna assess the airway for any trauma, any major trauma. The airway looks fine. There's no major trauma on the airway. Now I'm gonna assess circulation, so I'm gonna check the patient's pulse. Okay, patient has a pulse. Now I'm going to assess for any major bleeding, so I'm going to check the patient and see if there's any major bleeding. There's no major bleeding. Okay. And now I'm going to assess the patient's skin. The patient's skin looks normal. And now I'm going to treat for shock. So I'm going to keep the patient in the supine position, and I'm going to get blankets to wrap them up to conserve body heat. Okay. So now that I'm done with that, I'm going to make this patient a priority patient, code 3. So lights and sirens to the nearest healthcare facility. I'm going to now take the patient's vitals. So I'm going to take their blood pressure. I'm going to recheck their pulse. And I'm going to look at their heart, at their respiratory rate. And then I'm going to check their respiratory quality. So I'm just gonna get my stethoscope and I'm gonna listen to their lung sounds. Okay, the breathing, the respiratory quality is normal. I can't get a sample because the patient is unconscious, so I can't. I can see their signs, they're unconscious, they don't seem to be having any major bleeding. I can't get their symptoms, I can't get their allergies, medications. There is no alert bracelet on them. They don't have a phone on them, so I can't look through that to see if there's any emergency contact information or any medical information, and there are no witnesses. I just got a call from a secretary that said they saw a person fall out of the building. That's what 911 told us. So I can't get the allergies, the medications, I can't get any past history, I can't get their last oral intake, and I can't get their perspective of the events that led up to this event. Okay, so now I'm going to do a head-to-toe assessment. So I'm going to palpitate the head. I'm going to check the ears for any liquid coming out of them. I'm going to palpitate the face. I'm going to assess the nose, the lips. I'm going to assess the eyes. Okay, now I'm going to move down to the throat. I'm going to assess their C-spine. I'm going to see, okay, C-spine feels normal. I'm going to assess their trachea to see if there's any tracheal movement. And I'm going to check for jugular veins. It's all good. I move down to the chest. I'm going to assess their clavicle. I'm going to palpitate the chest. Okay. And then I'm going to listen into the chest. I'm going to recheck their lung sounds. I'm gonna auscultate. Okay, that looks normal. I'm gonna assess the abdomen. I'm gonna palpitate the abdomen. Okay, the patient responds to painful stimuli in the abdomen. I'm gonna continue looking at the other quadrants. It's throughout the entire abdomen. They respond to painful stimuli. I'm gonna assess the pelvis. No painful stimuli. I'm gonna assess the groin. There's no bleeding. And now I'm gonna move down to their lower extremities. I'm gonna palpitate their lower extremities. And I can't ask the patient to move their toes. I can't ask them if they feel me pinching a toe. And I can assess their circulation. The feet are getting circulation. Now I'm gonna move over to the upper extremities. I'm gonna palpitate the arms. Okay, I can't ask the patient to move their fingers, wiggle their fingers, and I can't ask the patient if they feel me pinching their fingers, but I can check the circulation. Okay, both arms are getting circulation. So now if I had other EMTs here with me, I am a single rescuer, so if I had other EMTs, we would flip the patient over, and then we would palpitate his thoracic and lumbar spine and his buttocks, see if there's any pain there, and then I would assess the back of the legs as well. But since I don't have anyone here with me right now, additional EMS is on the way. They'll help me with that, but since I'm the only rescuer here right now, I'm going to not assess that. I'm gonna assess that when I have backup. I just wanna take care of that C-spine, so I don't wanna move him and paralyze him. So now I'm gonna assess for any secondary wounds. While during my head-to-toe assessment, I didn't find any secondary wounds, so I'm not gonna assess that. And I'm gonna continue to reassess the patient every 5 minutes because they're a priority. I'm gonna see if the oxygen's helping. I'm gonna see if their vitals remain the same. If their vitals do start going down, they start decreasing, getting worse, I'm gonna try something different, maybe increase their oxygen from 10 liters of oxygen per minute to 15 liters of oxygen per minute. If everything stays the same, then I'm gonna keep this intervention, and that's it.